Eczema is one of the most common concerns I see as a dermatologist. So I thought it would be helpful to make a general video on what is eczema, how to best treat it, prevent it, and share some of my tips as well as products that I recommend to my patients and followers on Instagram and what we also use at home because both my daughter and I have eczema. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist in Minneapolis and welcome to my YouTube channel. On this channel, you will find me talk about all things skin and skincare related. So what is eczema? Eczema is just a large category, almost like a basket that we just dump various different types of inflammatory skin conditions into. It's basically used to describe inflamed, red, scaly, dry, and itchy skin. And there are various different types of eczema. Most commonly is atopic dermatitis that we often see usually starting off in infancy. There's often a genetic or familial component called atopy. But there's also other types of eczema that we can develop throughout our lives. There's even one that's called xerotic or steatotic or dry skin eczema that we commonly see in our elderly patients. Or nummular eczema, so nummular just means coin-shaped. There is hand eczema. Even seborrheic dermatitis is a form of eczema, allergic or irritant contact eczema, and so on. So all of these, essentially, what they have in common is that itchy, red, scaly, and inflamed skin. But also, in addition to the clinical presentation, what they all have in common is a defective skin barrier, which is really at the heart of eczema. We actually have quite a bit of studies on atopic dermatitis because it is such a common and very frustrating condition. And unfortunately, eczema is not curable because it boils down to that defective skin barrier. And in many ways, atopic dermatitis, because there is a large genetic component, there are ways we can manage it fairly well. And often for most individuals, it does get better over time. And so at the basis of all eczema, as I mentioned, is that defective skin barrier. What I mean by that is essentially, our skin is our body's largest organ. It's supposed to do a good job of forming this barrier that only allows water and certain things to penetrate, but also holds in water so the skin doesn't dry out and then prevents bad things from going into our skin, like bacteria, viruses, and other pollution, irritants. As far as the root cause of eczema, there is not one cause, especially when it comes down to atopic dermatitis. We frequently talk about the chicken and the egg. What came first? Is it the defective skin barrier that caused inflammation, or is it there is an underlying inflammatory abnormal response that's kind of built in genetically in that individual that leads to defective skin barrier? Either way, we don't know which came first, but we do know that both exist when it comes to eczema, atopic dermatitis, and various forms of eczema. And so because of that defective skin barrier, really improving your skin barrier, repairing it, taking care of it is really going to be key. Now, one of the most common questions I always get from my parents of younger patients or just older patients too, I always wonder whether diet plays a role. And I have to say that diet may play a role in individuals who have a history of atopic dermatitis. Even with that, it's a very controversial topic because what we know is that diet alone isn't the root cause of eczema. And even in kids that have really severe eczema that have food allergies, removing the food doesn't always correlate with clinical improvement of their skin. Furthermore, when they re-challenge with particular foods, it doesn't always flare with eczema. What we don't recommend is parents removing particular groups of food, such as dairy or peanuts, without the advice of your physician, because that can potentially lead to nutritional deficiency in a developing pediatric patient. So if you do have concerns, please see your pediatrician or your dermatologist where they can pursue further testing and to make sure that your eczema is appropriately treated. Lastly, what we do know is that stress can play a large role in not so much the cause of eczema, but definitely causing flare of your eczema. We see this a lot, and it's a very well-known phenomenon. Stress not only leading to flares of eczema, but psoriasis, seborrheic dermatitis, as well as acne and a lot of other skin conditions. So that is definitely something to keep in mind if you are noticing that your eczema is not is flaring or not as well controlled as it used to be. There can be multiple reasons, but stress can definitely play a role. So what can we do when it comes to taking care of our eczema-prone skin? As I mentioned earlier, because really at the heart of eczema is that defective skin barrier, skin care, taking care of your skin, supporting and repairing your skin barrier is by far key. For me, this is really not just a one-time or two-time thing, but really a lifelong habit, especially in those who have atopic dermatitis or prone to eczema. As I mentioned earlier, certain types of eczema, like atopic dermatitis, there is no cure. However, with proper skincare and treatment, often topical medications prescribed by your dermatologist, the goal is to really minimize the frequency, severity, and intensity of your eczema flares. So let's talk about how we can take care of our skin. There are certain bathing as well as skincare, moisturizing habits that I recommend for everyone, but especially for those who have sensitive, dry, and eczema-prone skin. So one of the biggest questions is bathing. How often should we be bathing? What should we be using when bathing? One of the most common misconceptions I get when I see my pediatric patients is that they're told to really limit the water contact time, bathing once a week. To the contrary, most dermatologists do recommend daily showers or even better, bath if you can. And bath I find to be a very effective way to clean our younger ones, our little, babies and toddlers who often do present with eczema. It's a great way to even incorporate into your daily bath time or nighttime routine. The reason why there is that misconception about water is that yes, if you do bathe without using any moisturizers afterwards, it will dry out your skin. But water itself doesn't dry out your skin. It's the fact that you bathe and then letting that water evaporate and not using any moisturizer on top of it that is the dangerous part. But bathing can be very, very helpful because if you have inflamed and itchy skin, baths sometimes can be very, very soothing. How you bathe is also very important. You want to use lukewarm, comfortable lukewarm water. You definitely don't want to use extremes of both hot and cold. Hot water can be very drying on the skin. You also want to limit the bath time to less than 15-20 minutes. Prolonged soaks can also be detrimental to the skin. So limit the bath time with the showering time. And then here's the most important thing is using the right type of soap or cleansers. Now, not all soaps and cleansers are created equal. In general, there are a few brands that you probably see dermatologists recommend over and over again because these are going to be the mildest, most gentle form of cleansers. Now, the act of cleansing itself is going to strip your skin's natural oil. And obviously, cleansing is necessary, right? To remove sweat, dirt, and if you have, soiled diaper areas, that is going to be important. But you want to do so and use products that are going to create the least amount of harm. And some of these cleansers even have hydrating ingredients that may add additional benefit. On a regular basis, most people, babies, kids, and adults alike, we do not need soap everywhere. Just armpits and buttocks where we sweat and when we get dirty. If you have a dirty kid, obviously use soap in those appropriate areas, but don't need to go aggressive and overzealous with soap because that can, again, be irritating. Even the most gentle cleansers will still strip your skin's natural oil because that is really what they do. That's how they work as cleansers. But some of the most commonly recommended products that I make to my patients and what we use at home is number one, the Dove Gentle Skin Beauty Bar. My husband and I use this mostly because we love it. It's gentle, but also we buy it in bulk from Costco. If you don't like cleansing bars, Dove also makes a cleansing liquid. It's a cream, it's a body wash that is very hydrating. And I use that in place of a shaving cream because it's that gentle and that hydrating. So that's another option for those who don't like cleansing bars. Now, CeraVe and Vanicream both make pretty gentle cleansing bars, so do check them out as well. Now, if you're not into cleansing bars and much prefer a cleansing liquid, then few that I recommend. One of them includes the CeraVe Hydrating Facial Cleanser. And you can buy this in a pretty large 24 fluid ounce. Now, just because it's a facial cleanser, it doesn't mean you can only use it on the face. You can definitely use it on your body because, skin is skin. Obviously, if you're really dirty, this might not be a great one to use to effectively remove, say, dirt. But on a regular basis, if just like a cleansing liquid, this is great to use all over. Another one that I really like is the La Roche-Posay Lipicard Cleansing Foaming Cleanser that you can definitely use on face and body, and I've used that on my daughter as well. Havana Cream has another one that is a foaming body wash that you can check out. It's a gentle body wash. I basically think of it as the same thing as their facial foaming cleanser, which is really gentle, but for the body. Now for babies and toddlers and kids, these are absolutely fine to use on them. However, having like a liquid instead of a soap sometimes can just be easier when you're bathing a younger child or a baby. So I usually kind of default to the same brand. For these, like I said, use the same thing, but if you much prefer to use their baby line, the formulation are very similar, and I have used them before and do use it on my daughter as well. So two of my favorites, aside from the Lipicard foaming one, is, and this one literally I ran out last night, but the CeraVe Baby Wash and Shampoo. And sometimes if she really wants a bubble bath, I will actually just pump a little bit more of this into running water. It doesn't create the most amazing bubble, but I feel like it's definitely a little bit more gentle than like the regular fragrance bubble baths. But this is great to use for head and body. Another one that is good is the Baby Dove Sensitive Skin. So these are a couple that you can definitely look into in trying out if you're looking for something that's multitasking for your little one. Otherwise, whatever that I've recommended in my previous recommendations works great for adults and kids alike. So those are a few products I recommend for bathing. Now, moisturizers are just as important, if not more important. Honestly, it's probably the most important thing you can do when it comes to healing a skin barrier and minimizing the flares and treating the eczema as well. The right moisturizer is really key. Here, again, not all moisturizers are the same. You want to use a moisturizer that's well formulated and has all the right humectants, occlusives, emollients that's gonna help to feed your skin the nutrients it needs to heal itself. Again, similar brands that I recommend, you guys probably have heard many dermatologists recommend this over and over again, and it's because we truly do love it and it works really, really well. One of my absolute favorite ones is from La Roche-Posay, the Lipicard AP Balm. And you guys have seen me talk about this earlier. This is a thicker cream that I use on myself, not just on my kid, but I do use it on her in the wintertime. It is a thicker moisturizer. I use this great for face and body. It's not comedogenic. And so I will use this in the wintertime on my face and body all over. In the summertime, they do make a lighter lotion, so if you really like this line, you can check out their lighter lotion, but I find that at least on my face, it's a little bit too thick with all the humidity and heat. But the reason why I love this is for a couple reasons. Number one, it contains shea butter, niacinamide, and glycerin, so really all three great ingredients in repairing and helping to soothe the skin barrier. Two, it contains La Roche-Posay's prebiotic thermal spring water. They've actually done studies of this brand of La Roche-Posay, the Lipicard line, and have shown that after consistent use, there is a change in the microbiota with this product. And we think it has to do not only with just repairing the skin barrier, but that prebiotic thermal spring water is like, in a way, nutrients for the bacteria in our skin to kind of balance everything out. And so after use of this, there is definitely an increase in biodiversity and decrease in overall Staph aureus. So they've done a couple clinical studies of this comparing individuals with eczema-prone skin before and after, as well as a similarly formulated product without the prebiotic thermal spring water. And this does make a statistical significant difference. But overall, I just like it because it's just a really good thick moisturizer that I think dry skin can really use in the wintertime, all year round if you really like it. And it's great to use for the whole family. Now you can definitely check out their similar Lipicard one. So it's the Lipicard Eczema, and it has very similar texture and consistency, but just has the 1% colloidal oatmeal that can add an additional soothing component. But both are great. I like this one because a pump is convenient when I'm trying to apply moisturizer after my rowdy toddler running off after the bath. This is just more convenient to dispense, really. Another one moisturizer that is just, again, an overall great moisturizer to use is, you guys have probably seen this over and over again, is the CeraVe moisturizing cream or lotion for those who want something but not super thick. And this, again, just contains a blend of good ceramides, triglycerides, hyaluronic hyaluronic acid. And we know ceramides plays an important role in the skin barrier and often are deficient in those with eczema prone and dry skin. And so this really helps to replenish the skin barrier. And CeraVe has this multi-vehicle emulsion technology where unlike other ceramides on the market, it's in vehicles that are meant to deliver the release of ceramides in a more sustained and slow release, so you get longer lasting hydration. But regardless, I think this is again a good overall moisturizer. You can get it in the tub, you can use this on face and body, and that's really why I recommend it. It's just number one for the convenience, for you can use it for busy moms who want one thing for the face and body, who want something for their whole family, and that is going to be fragrance free and helps to hydrate and soothe eczema and dry prone skin. Now, sometimes in the winter time when the weather is super dry, a petrolatum based product is what your skin needs. And in the winter time, on certain days, I will definitely just grease my daughter up and sometimes myself up too with a petrolatum based product. And one of my favorites is the Aquaphor line. We have the Aquaphor baby just because that's what we use on her, and the formulation is very similar, and I will use this on myself as well. Not so much to use all over the body, but maybe to treat certain areas that are extra dry and flaky. This is predominantly petrolatum. It is 41%. You can definitely just stick with the original petrolatum jelly. I buy this because it's just a bigger jar, so it's more, in my mind, economical. But in addition to petrolatum, this also has vitamin B5, panthenol, and glycerin that can be of additional benefit to the skin. Similarly, the CeraVe Healing Ointment has ceramides, hyaluronic acid. That tends to be a little bit lighter in formulation. I'll show you guys the CeraVe Healing Ointment. Even though it has 46% petrolatum, it actually doesn't feel as occlusive. So I actually love this. It's probably hard to tell on camera, but I actually love the CeraVe Healing Ointment for my face. If I want something that's more occlusive but not super greasy and heavy. And then Aquaphor, something like Aquaphor, great for the lips, for chapped hands, heels, and all over my daughter. But I don't know if you guys can appreciate the difference. So I have the CeraVe Healing Ointment right here, and then these you really just have to try and feel, but the Aquaphor is definitely greasier and heavier, which, sometimes that's what you need in the winter time. Another great one that I did mention is Vanicream. Vanicream has a moisturizing cream and a lighter lotion. Vanicream I often will recommend to my eczema prone patients who have a known history of contact dermatitis. In general, Vanicream's line tends to be of lesser number of ingredients, and often when speaking to my derm colleagues who are contact experts, that their line is often what they recommend just because of the minimal number of ingredients. So that is another great one that I recommend. And Vanicream also makes a hyaluronic acid ceramide based facial moisturizer for those who really like the Vanicream line but want something in addition for the face. Now, when it comes to using sunscreen, again, it's a more of a personal preference, but in general, I recommend sticking to mineral-based sunscreens. There are a handful of sunscreens that are chemical-based. I personally have not found an issue where it irritates my skin or burns my skin, but overall, mineral sunscreens tend to be better tolerated. And so a lot of the times you will see mineral sunscreens, or those sunscreens that are marketed for sensitive skin, to be purely mineral-based. Ideally, what you want to stay away from are like fragrances or a denatured alcohol that could potentially burn. But again, nothing's a guarantee, so obviously the best thing to do is to try on your skin, test it out first before you use it all over your body or face. So those are some of the products, my commonly go-to products at home, as well as what I recommend to my patients and on my social media. But in addition to the products, some tips that you can use on a regular basis, some habits that you can form are just as important. So we talked about bathing and the fact that daily baths are really important, keeping the water temperature lukewarm, limiting the water contact time to less than 15 to 20 minutes, limiting the amount of soap that you're using. But one of the key things is after your shower or bath, after you come out, you want to pat your skin dry. You definitely don't want to rub because that can irritate your skin. And then within literally a minute, when your skin is still damp and soft, that is really the opportune time, the really optimal time to put on a moisturizer, because that moisturizer is really going to help to seal any water loss through your skin, and also it's going to help to absorb better. So allow those ingredients, all those good ingredients, get into your skin to do its job. Obviously, you should use a moisturizer whenever. If your skin is dry, definitely go ahead and put it on. But one of the best times to use it is when your skin is damp, because that dampness from the water softens your stratum corneum, so ingredients can penetrate better. In general, I recommend with those individuals with eczema and sensitive skin to avoid products that are fragrances. Don't just look for ingredients that don't have an odor, because sometimes there will be a masking fragrance to cover up the odor or the scent. You want to look for products that are fragrance free. Alcohol, denatured alcohol, can be an irritant, but if you have sensitive skin and you tolerate it, then go ahead, by all means, use the product, and your skin will tell you if it burns after using a product, or if it turns red, then it's probably not the right one for you. Sometimes certain dyes can play a role in causing irritation. So at the end of the day, if you're still struggling after using gentle skincare products and treating your skin with the moisturizer, if your skin is really inflamed, then all the moisturizers in the world is not going to help. You need to see a board certified dermatologist, because inflamed skin needs an anti-inflammatory medicine. And so this is where we can help, prescribing something like a topical steroid that will calm down the inflammation, so that way your skin gets a chance to heal. Other things to keep in mind is that eczema, obviously one of the most common complaints is the fact that it itches, and we commonly kind of call it the itch that rashed, meaning the more you scratch, the worse your eczema is. And so if it's really itchy, obviously treating it is going to be the number one most important thing. But sometimes taking an anti-itch medicine, whether recommended to you by your provider or even a Benadryl, can be helpful. We tend to, in general, just be more conscious of the itching at night, and that is very common. So a couple of things you can do to minimize that is to keep your bedroom cool, to not overlayer yourself with blankets, because heat will often exacerbate the sensation of itch, which is why a lot of times patients will say, in the summertime when I'm sweating, the sweat can burn, can cause irritation, but also I'm itchier, and it's because heat can often bring out or make the itchy symptoms worse. Furthermore, you want to stick to clothing that's not going to irritate your skin. So stick to cotton-based clothing. Some certain types of wool or stretchy material can further aggravate irritated skin. In the wintertime, if you live in a dry climate like myself in Minneapolis, consider adding an essential humidifier or a bedside humidifier to really add in moisture, so that way your environment isn't super dry. When you're washing your hands, after each hand wash, if you can, layer on a moisturizer, because dry skin eczema is definitely something I see all the time in the winter, especially this past year with COVID. Lastly, if you have sensitive skin, maybe consider stopping your fragrances or colognes or other maybe fragrance hair products that may be inadvertently getting onto your skin that could be causing irritation. As I mentioned, please see your board certified dermatologist. You definitely don't need to be struggling with this. There are a lot of great options and medications that are very effective and safe that you can use, that we can help you with. One of the most common things I see in my skin color patients is not just the eczema itself, but the hyperpigmentation that can take much longer and can be more frustrating to treat. So seeing a dermatologist earlier on, getting on top of your treatment, is the most important thing. So that is a little spiel on eczema. I hope you found this video helpful. Please comment below with any questions or any other eczema related topics that you would like me to talk about. I would love it if you could give this video a thumbs up and subscribe to my YouTube channel. Again, you can find more information on skin and skincare related topics on my Instagram at derm.talk, as well as on my TikTok at Dr. Jenny Liu. Thank you so much for watching, and I will see you guys next time.